our location. We're going to begin escorting the patient below the helideck. Vital signs are still stable.
In the event of an emergency, preparation for the arrival of an ARSR Emergency Medical Services helicopter is critical for the safe and efficient treatment and removal of a patient from an offshore platform, rig, or vessel. When a medical emergency arises, please contact ARSR's 24-hour emergency contact number at 1-800-655-1414 to arrange for helicopter dispatch. Be prepared to provide the location of the emergency, preferably the block number, then the latitude and longitude coordinates if available, the name of the vessel, rig, or platform, the callback number, the caller's name and requesting company, the nature of the emergency, your helideck or vessel size, your radio frequency, whether or not aircraft fuel is available, patient injury information, preferred hospital. The patient does not need to be accepted by a hospital prior to arrival. ARSR will dispatch and deliver them to the most appropriate medical facility, and the local medic's name, if applicable. Some platforms have smaller helidecks that may not be able to accommodate the larger rescue helicopter. In these circumstances, there are several procedures for which you should be prepared. If the structure is not rated for the size and/or weight of the helicopter, or if the patient is on a vessel, you can usually expect the rescue to be accomplished by a hoist. In some circumstances, the helicopter may also conduct a light landing to deliver the rescue personnel. Platform or rig personnel can expect to receive a call via phone or radio from the helicopter when it's about 20 minutes away.
We're 20 minutes out from your location. 20 minutes out from your location.
During the call, a pre-arrival checklist with the responsible person will be covered. A second call will be made to inform you when the helicopter is approximately 5 minutes out.
Eyes visual.
The helicopter will overfly the platform or vessel to confirm the location and fly at least one orbit to become familiar with obstacles and the helideck location. After receiving permission to land from the platform, rig, or vessel, the helicopter will begin the final approach to landing, or hover for hoists. At this point, the helideck should be clear of obstructions, personnel, and loose equipment. After receiving permission to land or hoist, the rescue is normally accomplished with little or no required assistance from the platform or rig personnel. Upon the helicopter's arrival, the rescue swimmer and rescue paramedic will be lowered by hoist, possibly with a tagline. After delivering the medical crew, the helicopter will then orbit until called in by the medical crew for pickup. In some cases, the helicopter may use this opportunity to fly to a nearby platform or rig for fuel. Although under most circumstances you will not be on the helideck, it's important that the following safety rules be understood. It is extremely important to provide a clear area on the helideck for hoisting. Remove all loose or light objects on or around the helideck, as they can pose a hazard to both personnel on board the platform and to the helicopter itself. Loose objects, such as articles of clothing or equipment, can be blown overboard, injure other people, or be caught in the rotor wash and drawn into the helicopter engines or the tail rotor. All crane movement must be stopped and the equipment removed or pulled out of the way of the helideck area prior to the helicopter's arrival. Under most circumstances, unless you have been informed otherwise by the helicopter crew, no one should be on the helideck surface when the helicopter approaches, as the downwash of a helicopter is sufficient to blow a person overboard or cause other injury. Do not use flash photography or direct lights toward the helicopter, as this may interfere with the pilot's vision. Do not bring the injured person to the helideck. The helicopter medical team will go to them and assess their condition to determine the best course of action. A helicopter in flight builds up static electricity. Always allow the rescue device to contact the helideck in order to ground the static discharge. Be careful of cable entanglement. A static cord may also be used to dissipate the static charge. Never attach, tie, or secure anything to the helideck that is also attached to the helicopter. Always tend the taglines by hand. Never attach them to the helideck. Please direct the paramedics to the patient's location. The paramedics will treat the patient as required. Once any on-site medical aid has been administered, the medical crew may request your assistance to help move the injured or sick person to the helideck. Depending on the patient's condition, one of several different methods may be used to lift them to the helicopter. The Stokes basket litter and the patient extrication package, referred to as a PEP bag, are designed to be used when the patient requires spinal immobilization or is non-ambulatory. The paramedic and rescue swimmer will load the patient into the litter or PEP bag and secure the 4 straps across the patient's torso, chest, and legs. After the patient is secured in the litter or PEP bag, please assist paramedics in transporting the patient to the helideck. All Stokes litter and PEP bag hoists will include use of a tagline to reduce the onset of spins, oscillations, and pendulums. The paramedic will normally accompany the Stokes litter or PEP bag in a tandem hoist with the patient when necessary for medical care. This capability is essential if the patient is on assisted ventilation, has a head injury, or exhibits any combativeness. If the patient is ambulatory and does not require stretcher evacuation, the medical crew may choose to use a Bowman suit or a victim seat harness. When being lifted by the Bowman suit or seat harness, the patient should keep their hands away from the hoist cable and carabiners. Again, the paramedic will normally accompany the patient in a tandem hoist. As with the litter or PEP bag, a tagline may be used to stabilize the lift during the hoist. When reaching the helicopter door, the patient will be situated head or back first into the aircraft. The patient should keep their arms close to their body. The patient will feel the hoist operator pulling him or her into the aircraft. Once inside the helicopter, the patient will be placed on a medical bed or passenger seat as appropriate. The paramedic will assist them. Regardless of which method is used to extract a patient from the platform, always keep the tagline and the hoisting cable clear of objects on the platform. The rescue paramedic will always unhook the rescue device as quickly as possible. Please follow their directions and ensure that you are clear of entanglement from the hoist cable. Once the patient is secure in the helicopter and all of the crew members are ready, the helicopter will communicate with the platform that all is good and will then depart. Of course, ERA always stands at the ready to answer any questions or assist in training exercises. Please contact ERA at 1-800-256-2372 for further details. Your safety is ERA's first priority.